Well, stem cell transplants are really done to allow us to give curative doses of chemotherapy in patients that have not been cured with other treatments. And so for us, the advantage to it is that we can give high doses of medications that couldn't be given any other way in patients that have not responded to conventional doses of therapy. And so what it allows us to do is to get around the problems that you have with low blood counts and toxicities and things of that sort, because we protect the stem cells so that they don't see the high-dose chemotherapy and then give them back afterwards. And so what it does is it allows us to rescue people's bone marrows from the effects of high-dose chemotherapy, which then hopefully will kill the tumor. The best candidates for any kind of stem cell rescue are really the hematologic or the blood-borne diseases, and our primary focus has been on those diseases ever since we started the program. The main diseases that we're interested in right now are multiple myeloma and non-Hodgkin's lymphomas, and those diseases represent a relatively small number of the total malignancies, but for us, they're a major bread and butter of what we do, and it's the emphasis of our program. We wanted to be able to offer to our patients therapies of all different sorts in the program here in a facility where we can communicate with their physicians. They can stay in their communities as much as possible and still get the state-of-the-art treatment that we think they deserve. And we found a real niche for this in terms of our patient population, because there are going to be a certain percentage of patients that will fail standard therapies and will need these treatments. And as opposed to having them start all over again or go to a new system or leave town, in many cases we felt that it would be better to keep them closer to home and give them the state-of-the-art therapy. So that's been the goal of our program ever since we started it. Since we basically have access to the entire system through the Aurora system, that we can communicate with patients' physicians, they can find out what's going on, their families can find out what's going on with our patients even when they're here getting the treatment. But it also allows us to interface with the other parts of the cancer program in a way that gives complete care to these patients. And we feel that it's a multidisciplinary program all by itself, because we do involve dietary, we do involve all the supportive services that are available, and you need that for a very complex procedure like a bone marrow transplant or stem cell transplant.